My name is Helene Alphonso, DO. I am a psychiatrist in Fort Worth, Texas. I'm also board certified in addiction medicine as well as lifestyle medicine. I work for a county hospital in Fort Worth, Texas called John Peter Smith Hospital. So our lecture is broken up into 4 different parts. So section 1 is what history has not taught us. This takes the population studies that we have seen at every CME conference about ADHD and compares their findings to some of the newer randomized controlled trials to help clinicians develop a reassessment of what our current risk-benefit interpretations are of prescribing stimulants for ADHD. Section 2 is the perfect storm. This is led by Dr. Farouk, who is a child psychiatrist, who outlines the changes that have occurred in the education system and reviews the randomized control trials that have contributed to increased prescribing of stimulants in the past 25 years. We also do provide some proposed solutions for educational systems to possibly consider adopting to make education more accessible for all students. Section 3 is Neuroscience is Truth. Dr. Natek is a colleague of mine from the Neuroscience Institute at UNT Health. And she is a neuroscience researcher that will be reviewing the principles of how stimulants affect brain physiology. Her research is based regarding dopamine circuits. So she has articles that she will go over regarding addiction, Parkinson's disease, and how all of this can be related to stimulant use. Section 4 is what comes next, and this is done by Dr. Khan, who is a women's health and perinatal psychiatrist. She will be reviewing the population-based studies and animal studies in pregnant women since there are not randomized controlled trials for stimulants in ADHD. Right now, with the ability for us to data mine from our electronic medical records, we are seeing a lot of population studies. I've even done a population study myself. And while these are useful, they do not equal truth. So one tip is do not let the large N seduce you because population studies are not equal to randomized controlled trials. Number 2 is that ADHD should really be seen as a spectrum disorder. I do believe we need a validated screen to determine which ADHD patients are at higher risk of consequences. Part of it is based on my colleagues who work with me at John Peter Smith Hospital, and we have kind of been discussing these things throughout the years. For the last 8 years, I've given lectures across the country that shows some of the parallels between the opiate epidemic and stimulant prescribing and how it's changed over the last 25 years. In these presentations, as you can imagine, there's a lot of strong emotions. What has surprised me, however, is that physicians have thanked me afterwards, saying that I'm giving voice to the thoughts of what many providers feel, and that sometimes they feel trapped and would rather prescribe non-stimulants for patients with ADHD.